Moving on, in a sharp contrast with global trends which show a decline in cancer-related death rates when adjusted for age, India is seeing an alarming rise in mortality rates. Most cancer cases in India are detected in late stages, leading to poor prognosis. A new study published in The Lancet reveals a 26% surge in cancer cases in India since 1990, with the incident rate rising from 84.8 to 107 per 2.2 per 1 lakh population by 2023. Cancer deaths have also increased by 21% over the same period despite advancements in treatment. This alarming trend stands in stark contrast to countries like the US and China, where both cancer incidence and mortality have significantly declined due to robust tobacco control, universal vaccination, and organized screening programs. Experts point to India's high tobacco use, rising obesity rates, and limited access to early detection as key drivers of this crisis. The study also highlights that 42% of global cancer deaths in 2023, around 4.3 million, were linked to modifiable risk factors, with tobacco use alone accounting for 21% of cancer deaths worldwide. In response, a 2023 parliamentary committee reported India has called for higher taxes on tobacco products to curb their affordability and urged linking cancer registries to the Ayushman Bharat digital mission for real-time patient data. The report also stressed the importance of early detection, proposing a nationwide mass movement for timely cancer screening, including dedicating a specific day each month for screenings, similar to reproductive and child health initiatives. As cancer cases continue to rise, experts warn that urgent action is needed to reverse this trajectory. So why are cancer cases and related deaths rising sharply in India, and how can one reduce this risk? This is something that we will discuss with our panel of experts. Mr. Ankit Modi, Chief Product Officer, Cure AI, joins us on the broadcast. Padma Shri, Dr. Sanjeev Bagai, Chairman of Nephron Clinic, is also with us. Dr. Monik Mehta, Senior Consultant, Cardiologist, Manipal Hospital, Fellow of American College of Cardiology, is also joining us on the broadcast. Dr. Bagai, I will begin with you. Well, first up, tobacco is one reason, but it's not the only one which has been attributed to cause cancer. A number of new things have come to light, and of course, with the advent of social media, this knowledge or this know-how has disseminated, but yet it is surprising to see that with avenues of knowledge being available, cancer continues to be on the uptick. Why do you think that is? India before 1990, before liberalization kicked in, did not have the epidemic of cancer that we do today. Why do you think this is, and how can we stop it?
Good evening. I think we are no longer approaching an epidemic. We are already sitting right on top of a volcano. The cases are increasing exponentially. As all reports have said, including the Lancet report, 26% increase in incidence and 21% increase in the death rate in the last 2 to 3 decades. We are losing one female every 8 minutes as death, which could be preventable. For every 2 women who are being screened, we are losing one. We are losing more than 2,500 Indians. 2,500 Indians every day. That's approximately 10 lakhs a year. And the statistics keep rolling on. I mean, the commonest causes of this is we are looking at lifestyle and we've forgotten to look at life. If you look at the major causes, of course, tobacco and smoking is number one, is the highest precipitator of cancers in men and women. Alcohol, what we say as the big S's. So it's smoking, spirit, which is alcohol, sedentary lifestyle, which causes obesity, excess sugar and excess salt, which causes all points towards obesity. Abnormal trends in behavior. The patterns right from childhood are changing. Yes, we have very, very good vaccines, which are hepatitis B and human papilloma virus, which we call as HPV, as two preventable vaccines to prevent cancers. But I think screening is the key, early detection is the key, and early treatment initiation is the key. What we are lacking is a huge public awareness campaign. What we are lacking is to convert the data of school health program checks into a modulated strategy to prevent obesity. Even now, in today's date, we don't have children who are screened with a simple measurement of a blood pressure. A lot of the children still go out of the OPDs without a weight check. This is something which we need to ingrain into our own medical system. But long and short of it is, cancer is largely preventable. There are genetic causes which we can do nothing about. But overall, early diagnosis, early intervention, early treatment, most important, public awareness and screening.
You're absolutely right. Ankit, thank you for being here. I appreciate you are a busy man. But, we talk about curing cancer, but there is obviously, there's another avenue that needs to be looked upon, and that is how to prevent it from happening and how to detect it. Your company, Cure.ai, has done tremendous work in trying to screen people to detect and figure out if they have any of these deadly diseases and some of the other diseases as well through early detection and awareness. What do you make of this data that has come about, and what can be done by using and leveraging technology just the way your company has been doing?
Thanks, Vineet. Our experience has been amazing with regard to this. I would give you some stats, like 70% of cancers, especially like take lung cancer for example, 70% of cancers are detected in stage 3 and 4, which is basically too late to do anything about them. Like the mortality rate there is very, very high. Whereas if these same cancers can be detected in stage 1 and 2, the chances of survival are really, really high. With respect to that, we felt that setting up screening programs takes a lot of infrastructure cost, campaigning costs to run these programs. What we thought was there are around 10 crore chest x-rays being taken every day, every year in government facilities in India. And they're being taken for n number of reasons, whether it is simple cough or pneumonia or annual health checkups. And we felt that these x-rays have simple signs of cancers that can become malignant 2 years, 3 years down the line. We tested this hypothesis and we indeed found that for every 1,000 chest x-ray, we were finding one new lung cancer patient. And this is not just theory, we have published evidence on it, and we ran a state level incidental detection program in Goa, where we screened more than 70,000 people over the last 1 year and have found 6,000 malignant nodules, which have high chances of becoming cancer. So that is the impact that it can be created with AI-led surveillance on existing chest X-rays. The key thing here is that all you have to do is the infrastructure is already there, the X-ray machines are already there, people are reading it. All you have to do is add a layer of AI on top of it, and you can surveil these chest X-rays for not only lung cancer, but other lung-related diseases like COPDs or even heart failure risks as well. So having said that, we feel like, I mean, the amount of data being generated in India, especially in healthcare, is huge. And if we apply healthcare surveillance on top of it, a lot of lives can be saved over there.
Ankit, Dr. Bagai also spoke about, a public awareness campaign, and that obviously would incorporate the government taking a number of initiatives. And I think that at this point in time is missing. At this point in time is not being taken at the urgency and at the curiosity that it should be. How can that be changed, and how can you guys help?
No, definitely, Vineet. I think most of our healthcare focus has been around communicable diseases. But the time is right now to focus upon non-communicable diseases like cancers. We have seen governments focus to be tremendous upon AI adoption across fields. They have set up an India AI mission and are helping startups and new ideas getting funded to scale such solutions. And over there as well, I have seen tremendous focus on healthcare. So with such surveillance-led programs, we can definitely build out tools, and not only for chest X-ray, like tools like mammography or smear tests, large-scale campaigning program where, I mean, we can just let people know that such yearly screenings or even incidental detection pathways can actually save them. Today, I mean, people aren't aware that cancer is preventable if you get detected early. The problem statement is, how do you get detected early? It's only when you are already aware about such probabilities of getting such diseases uh, at an early stage. So that is what, like, I mean, that we need to solve, and it has to be together, like government, the private sector, startups, all of them have to come together to create this awareness, to create this campaign, so that like we can really, really come together to save lives.
You're absolutely right, Modi, and that's well said. And Dr. Mehta, taking a leaf out of what Ankit also said, that and that is also the premise for averting any kind of a disease, which is prevention is better than cure. But it is something that has to be driven from the top. It has to be driven from the government's side as well, because a number of these cases that we spoke about, the plethora of these cases are found in government hospitals.
Yes, I agree with you. And it's a tragedy that we are now facing this huge onslaught of cancer or non-communicable diseases now surfacing on such vast scale in India. The level of communicable diseases is going down, especially in the urban environments. And the causes is has been just enumerated by my previous speakers. But I think we should be focusing not only on the treatment, but the prevention. And prevention is the I think should be the focus of our strategy at the moment. So the prevention is what I think is the step by which we'll be able to overcome the hurdle. We are an aging population, and as the population increases, the incidence of cancers is going to go up. And as with the medical facilities improving in a country, a pickup of cancers is also going to go up. But the preventable aspect is the thing which we can focus on, and by which we can get hold of the numbers that is increasing at such a large scale.
Dr. Bagai, it's also a lot to we've been talking about smoking, we've been talking about tobacco, but there are other carcinogens that are wreaking havoc on everyone's body in the country as well as around the world as well. Fast food, high fructose corn syrup, sugar, hidden sugar. This is obviously another hidden ingredient which most people do not in fact even bother checking, and is contributing to obesity, to diabetics, and a number of other metabolic diseases as well. This is something which is not even being touched upon by the government. This is not even being discussed at any forum.
So, three quick points. I think it's extremely vital that you brought this up. So I think food and dietary habits is the cornerstone of all human beings. But unfortunately, in India, in the last 20 years, I think we've gone berserk. If you look at a child coming in with parents, the parents are never satisfied with a child who's even overweight. They feel that the child is not eating enough. I think that mindset has to change. Aerated drinks is a curse on India. I think Coke and Pepsis have ruined today's generation and many generations coming forward. The energy drinks are even more worse. They have a lot of ingredients which are stress inducers, and they release a lot of hormones in the brain and in the body, in the heart and other areas, which can actually precipitate a lot of tumorigenesis. Very important is the so-called substitutes for sugar. So even the artificial sweeteners are not safe. But I want to come to a larger point with your permission. Two very quick points. We must talk in every cancer debate and other non-communicable diseases, or what we call as lifestyle diseases, or any other major chronic illness, is air pollution. Air pollution is a very major ingredient towards causing cancers of almost 18 or 20 different parts of the body. The second is plastic hazard pollution. Plastic is an invisible ingredient in air pollution. Winter is approaching in northern India, and we are going to see the scourge of this with the high AQIs, PM 2.5, and a lot of other ingredients of plastic which are very harmful. Lastly, we have to have health insurance which is within reach of a common person. Yes, I know that there is a 50 crore cover of 5 lakhs per family for Ayushman Bharat. That's fantastic. But the routine insurance penetration must go even deeper. The insurance has to become cheaper, and it has to include screening. A lot of the insurance companies do not include OPD screening. You have tumor markers. Look at PSA. prostatic sensitive antigen for prostate cancers. It's been used widely for years and decades together, and it's given excellent results. We must include the OPD screening and executive health checks as a part of our insurance so that we can have a better penetration. The key is if you pick up cancer early, the survival rate, 5-year survival rate, 10-year survival rate almost doubles or triples. A patient comes in stage 3, stage 4 with metastasis, that is spread of the disease internally. It becomes a horror story for the family and out of reach financially too. Over to you.
Ankit, what do you think can be done in terms of adoption by the public and the private sector as well, in terms of the screening that is so very much needed at this point in time? Like I said, prevention is better than cure, and that means also integrating technology into how fast you can detect these diseases.
Right. Vineet, I think first of all, we have to build that layer on top of what is already existing. We have a huge network of X-ray machines across PHCs and CHCs. We need to enable these healthcare sites to have other screening devices like mammography machines or pap smear tests, and really encourage our public to go for annual checkups. Maybe Ayushman Bharat and other insurance schemes can fund that yearly checkups for the company. And it's not like it's we don't have hope. We have success stories like eradicating polio through mass vaccination and mass awareness campaigns. If we can replicate that playbook with cancer, there's no reason why we cannot solve for it. India has the right scale, the right spirit. We have also got now the right digital backbone with ABDM and Ayushman Bharat. And I think with the growing cancer care infrastructure, we are uniquely positioned to make cancer prevention and early detection accessible for every citizen.
All right. Dr. Mehta, where are you placed on this? Early detection is the key here, but at the same time, the government has to play along when it comes to opening up doors, to companies just like your.ai and other, firms who are doing work to enable the common man to have access, to preventive care.
So I agree with you. Access to preventive care is important. I think we need to focus on access of preventive care, the knowledge or education of our public. So they should be knowledgeable about it and they should go out and access that. It's a lot of these preventive tests are available in our society and in the market and the media and everywhere. But awareness is also something which is challenging. Most of our people are not aware that they should be going for health checkups or these preventive health checkups. And in these preventive health checkups, cancer screening should be a very important component. So basically, awareness about cancers in the general public is what is going to drive our population to go and get themselves tested. Uh, we should also not forget the role of management of our traditional risk factors like alcohol and smoking. So if we attack those traditional risk factors, we are treating not only cancers, we are treating so many other issues. Like for example, for me as a cardiologist, a prime focus being cardiology related issues. So it's going to be a manifold benefit if we are addressing the traditional risk factors. So that is our diet, our lifestyle, our physical inactivity, and addictions like tobacco and alcohol, and even recreational drugs. So we should focus on these preventive aspects. Dr. Bagai has already mentioned environmental pollution is becoming a newer hazard in our present day scenario, and we should not forget the role of vaccinations. So especially the treatable issues, for example, hepatitis B vaccination, and for our women folk, the
All right.
HPV vaccination is very, very important.
All right, fair enough. Dr. Bagai wanted to come in. Dr. Bagai, before we wrap up, so you wanted to say something?
Very quick word. I think as a community, as a nation, we have to be more sensitive toward which part we are going. If you have Coke and Pepsi and aerated drinks supporting national and international Indian sports teams, it gives a very, very wrong messaging to the youth of our country. If you see hoardings of fast food joints in the stands, wrong messaging. But more importantly, if you just saw the Asia Cup, you have gutka, pan masala ads coming every 3 minutes. what are we doing to our next generation? Wrong. This has to stop.
You're quite right, sir. And on that note, we'll take a break, but would also like to thank all our guests, Dr. Bagai, Dr. Mehta, and Ankit, for taking out the time and speaking on this important and imperative issue. We take a short break. We'll be right back.